I'm Ken Reel, CEO of the Cape Ann Chamber of Commerce. We're very pleased to have you here this morning at our annual Economic Outlook Breakfast. So in the past, we would typically hear from an economist. Last year, we actually heard from the president of Gorton's, Judd Reese. It's fantastic commentary. And this morning's event is focused on healthcare. And so healthcare impacts every single person in this room and has a big impact on what the Chamber is all about, business, and especially small business. And so we're very pleased to have Phil Cormier here this morning, CEO of Addison Gilbert and Beverly Hospitals, to talk to us about the big picture what's going on nationally, but really to focus on what's happening here at home with our two hospitals locally and the whole merger of Beth Israel and Lahey Health. So I'd like to introduce our 2019 president, Bruce Feldman, and we'll take it from there. Come on up, Bruce.
Thank you, Ken. Thank you, everybody. Hi. Thank you all for coming and welcome. Just wanted to,
Bruce.
That's all right. Again, good morning and thank you all for being a part of the Economic Outlook Breakfast. I'd first like to acknowledge the Cape Ann Chamber Board of Directors, past presidents, and elected officials, and please hold your applause until the end. Christine Armstrong from Armstrong Brand Consulting, Lisa Bonneville, Bonneville Design, Cynthia Capasso Donaldson, Lahey Addison Gilbert Hospital, Meredith Fine, Cape Ann Business Law, Susan Gould, Carviello, North Shore Health Project, Richard Ross, Project Adventure, Bonnie Scatterday, Woodmans of Essex, Catherine Wall, Bank Gloucester, and also the past presidents. It's Robert Gillis, Cape Ann Savings Bank, 2006, Sal Frontiero Law Office, 2011, and Mark Grenier, Bank Gloucester, 2012. The elected officials here today: Safathia Romeo Thankin, Madam Mayor, Paul Lundberg, Councilor at Large, and then Jim Destino, Chief Administrative Officer. And thank you all for coming. I appreciate it. I'd like to welcome our featured speaker, Phil Cormier. Phil is the CEO of Addison Gilbert and Beverly Hospital and a part of the Lahey Health. Phil, wherever you are.
Here, come on up.
Come on up. Thank you.
Thank you, Bruce. Thank you. So, first of all, I want to make sure, can everybody hear me okay? Can you hear me okay in the back? All right. Can you hear me okay in the back now? No? Okay. I just want to make sure I have this. I also am wired up here for I believe this being taped. And I'm just going to turn this way so I can see the slides a little bit better because that allows me that. First of all, we're at the very end, so can we go back to the beginning? And that's the end of my concluded remarks. Thank you very much. I hope you appreciated that outlook. It is rosy.
You only had a minute, though.
So I apologize. I asked them, my slide deck might be longer than the time allotted, so I asked them to give me a time check about halfway through. But if you do fall asleep into your frittata there, I'll know that's another indication. So I do want to recognize some other people in the audience, please. Nancy Palmer, our board chair, is at the table. Thank you very much, Nancy. She's volunteer board chair for quite a period of time here. We certainly appreciate that volunteerism. And also, Paul Lundberg, in addition to being City Council President in Gloucester, is also chair of our Quality and Safety Committee. Paul, wherever you are, back there. Thank you very much. We are a 501c3 not-for-profit, which means that our board volunteers for that effort, does not get any compensation. We certainly appreciate their guidance and direction over the years. And I also like to, everybody knows Cindy Capasso Donaldson. Cindy is the face of Addison Gilbert, and I'd just like Cindy to stand up and be recognized. Thank you. There's quite a few other members of our team here, but they're plants, so I'm not going to recognize them. Thank you. Next slide. So whenever I can't sleep at night and I don't remember why, I look at this list, and this kind of reminds me what we worry about on a daily basis. Most of you are business people in the room. Raise your hand if you're business people or operate a business or own a business. And you'll see a lot of these are common to you also, right? These are the same things that you worry about. So the reality is although healthcare has a unique niche in our society, you want us to be a business. You want us to operate like a business, and with that business comes obligations and responsibilities to provide care, but provide it in a safe, quality, and also cost-effective way. I'll talk a little bit about not every one of these, but a lot of these challenges and opportunities that we face in the future, in the past, and also in the future. The other component about that is that if there's any question about the safety or quality of our hospitals, I'll just give you one that's on the last slide, but I'd like to mention it now, which is there's an organization called Leapfrog that takes publicly reported data and data that we report to them and judges quality and safety of hospitals versus other hospitals in the United States. 2,600 hospitals on the database. They give us grades twice a year, A through F, just like you might have gotten in school. I won't tell you how I did in school, but just like you might have gotten in school. And the most recent time in the fall, we got an A for quality and safety, both Addison, Gilbert, and Beverly. Thank you, but a larger round of applause, because since they started grading us in 2012, we've gotten straight A's. 2,600 hospitals in the United States that get judged, 46 have been straight A's. Addison, Gilbert, and Beverly. And that's certainly a tribute to our board, Nancy Palmer, Paul Lumberg, and our efforts. We still can do more, but that's quite an accomplishment. Top 2% of hospitals in the United States. Next slide. So this is the overview. We're going to talk a little bit about healthcare environment, the background of Addison, Gilbert, and Beverly hospitals, Beth Israel Lahey Health, which is our new organization that will start as of March 1st. New services at Addison Gilbert Hospital. I think that's what you'd like to hear. What's next? If we get a chance, values and successes, and then I will leave time at the end for questions. What we're not on today's overview is national political discord and its impact on healthcare. Do you really want to talk about that? I don't either, thanks. History of Massachusetts healthcare policy, I could bore you with that, but you don't want to hear about that. And I'd also like, Massachusetts is the envy of the country, but the rest of the country hates us. And next, it's not our healthcare, it's our sports teams. We do have the best healthcare. Unfortunately, we do have the best sports team too. So there is a CEO out at Beverly Hospital just outside of Los Angeles who's wearing Patriots outfit today because she lost a bet with me as to who was going to win the Super Bowl. So, but healthcare environment on the national level, you might have heard that there was that we have the highest cost of healthcare in the world, rather, and yet quality is less than some of the other developed countries. Some of the reasons for that, there are a multitude of reasons. One of the reasons that I'd like to point out is because most of the other developed countries spend more money on what we call social determinants of health, which is housing, employment, food, and that's really where we as a country have to go in healthcare. And you as a business also have to be concerned about that. Because if we don't, the increased cost of healthcare, the rampant inflation on healthcare will continue to go up if we don't get to some of those base issues. At a state level, Massachusetts is among the state with the highest quality or highest cost for health care. And this preceded Romney Care. Everybody remembers Governor Romney? We were the first in the country that had universal health care in Massachusetts. ACA changed that quite a bit. But the good news, Massachusetts has among the best quality health care in the nation. Next slide. Better news, recent cost trends, which I'll go into, show that we're decreasing the cost, which is great. The best news, or better news, Addison Gilbert, Beverly Lahey, and the new Beth Israel Lahey Health are known for high quality, low cost. And the best news, we need to do more, and we will be different than what you've seen in the past. Thanks. So this is a slide that just shows some of what's happened to inflation in healthcare over the past years. This is a little dated slide. It goes back to 2017, but the trends are the same. And what it showed is, again, if you're business owners, you can see 4.2, 4.8 inflationary index, and then you started to see with price regulation, the cost curve came down, and that is terrific for you, for us, for our citizens of our Commonwealth. Next slide. This shows the same graphic, and next slide, please. This shows the same data, but it talks about how we compare with the rest of the country. And even though we had 11% inflation, the rest of the country had like a 23% inflation in hospital costs. Can you imagine being a business and trying to absorb 23% inflation on your cost basis? Do you feel that in your premiums? I would be looking for a response from you. Do you feel that in your healthcare premiums? Thank you. On the national level, in terms of legislative, there was a Texas judge ruling on the Affordable Care Act, said it was provisions of it were unconstitutional. That's being challenged in court, so we don't expect any changes in the near term. We believe that's advantageous. To quote our new CEO of Beth Israel Lahey Health, we don't view healthcare as a privilege. We view it as a right. We hope you have that same view. Medicare, continued pressure to reduce spend. Pharmaceuticals, continued pressure to reduce cost. If there is one entity in healthcare costs that needs to be more highly regulated, it is pharmaceuticals. I'm sorry, are there any pharmaceutical reps in the audience today? No, great. Okay, so everybody join me in saying that yes, they're the bad guy? Thank you. A Democratic House in Massachusetts, the legislative, where they've been placed in the House, is going to give us some advantages in terms of not getting disadvantaged by the rest of the country, so that's helpful to us. On the state level, 1 in 4 citizens of the Commonwealth have Medicaid or Mass Health. 1 in 4. That's a lot, which means that's the single largest line item on the state's budget. And obviously, inflationary pressures on that will be at the sake, or will affect other things such as anything else they want to do, transportation, business initiatives, anything along those lines. There's a business initiative in Massachusetts to reduce the inappropriate use of emergency departments. We'll talk a little bit more about that in a few minutes. And there are multiple legislative and government initiatives to improve quality, reduce cost, or provide additional access. I won't go into those either. So background, Beverly Hospital and Addison Gilbert. In the 70s and 80s, most communities on the North Shore had a community hospital. There were about 12 of them in total. In the 90s, because of some of the financial pressures and also clinical considerations, and what do I mean by clinical considerations? We came to the realization that volume, the more you did of something, the better you were at it from a quality perspective. And therefore, community hospitals could not be all things to all people. We got together and formed Northeast Health System in the 90s, and then further iteration of that in the 2012, we joined Lahey Clinic. I'll talk a little bit about that. And then in March 1st, in about 3 weeks, we will join with Beth Israel Lahey Health to form a brand new system. Same kind of pressures, same kind of desire to have scale, to be able to achieve economies, to be able to improve quality, have made these changes. Can we go back to that slide just for a second? And I think the important part about that is that we've had to evolve, just as you as businesses have had to evolve, right? You've had to change as there's other pressures, whether those pressures are technological pressures, qualitative pressures, or that you need it to be a larger scale. We've also had an opportunity to do that. Next slide. So this is just some slides about various services that we have. I won't go into in depth on this. I think the key here is that we've taken a look at what we do and do best, and we've tried to concentrate that in our various campuses. A lot of things we do at Beverly, we don't do at Addison. A lot of things we do at Addison, we don't do at Beverly. That's not a bad thing. That's a good thing. We do have a particular inpatient medical at Addison Gilbert. We have an award-winning inpatient geriatric psych called the Senior Adult Unit that attracts patients from outside of the geography. We're looking to expand that. We have an extensive array of outpatient services and clinics, more than we do at Beverly. We still have an emergency department. And what is it, Saturday? We've got the 1-year anniversary of the urgent care. Is it Saturday? And we'll talk a little bit about that too. Next slide. This is just our other sites. Bay Ridge Hospital in Lynn, 62-bed psych facility. Lahey Outpatient Center Danvers, which Cindy is also in charge of. And that has an array of outpatient services, much more than Beverly Hospital. This is how we work as a system, to be able to concentrate those services, provide the highest quality, provide access to care, but not necessarily duplicative services across our continuum. Next slide. This is, again, our slide, busy slide. I think the important part is you have 2,700 employees. We are, in Beverly and in Gloucester, some of the largest employers. And we believe that's a benefit to the community. As business people, do you believe that is too? Yes. Great. Anybody here work there? Sorry, just kidding. Those plants, you'd give yourself away. We'll go to the next slide. So in 2012, even though we were successful as Beverly and Addison Gilbert's hospital, we didn't have what we needed to continue to be successful in the future. And one of those was scale. We weren't large enough. The second of that was we didn't have access to an academic medical center or tertiary care that provided services that we weren't able to provide ourselves because of some of the factors I said before. And so we joined Lahey Clinic. That was terrific for us because Lahey had the same value system as us. They were low cost, high quality, and they supported community hospitals. We were able to send patients to Lahey for advanced care. They sent patients back to us to Beverly and Addison Gilbert for that advanced care. It's not uncommon, not all of our patients, but that we would find a patient would appear in the emergency department at Beverly Hospital. We would send them to Addison Gilbert for their care because the care was better, there was availability, or the same thing that Addison Gilbert, they would be sent to Lahey in Burlington because the more appropriate services were located there. The result of that was local residents have convenient access to community hospitals for community level, advanced capabilities of Lahey, and what we called right care, right place, right time. From a business perspective, that's what you want. You want us to be able to provide the best care at the best place in in easy access. Next slide. So what did we do on that? We've obviously got an electronic medical record that allows us to have those patients so that if you do show up at those various sites or if we need to transfer you to those various sites, we understand what care you've been delivered within our system and can help coordinate that. We're the largest provider of behavioral health services in the North Shore. That's certainly part of the legacy Northeast Health, Beverly and Addison Gilbert, but it certainly will be a case in the future. Addiction services, we have an extensive array of services. Starting our emergency department, we've always had a commitment to addiction services, particularly at a Discover program at Addison Gilbert for 30 plus years, somewhere around there, Cindy. We take advantage of our system in order to provide the highest quality at the most affordable price. As I said before, we don't do everything at each site. We're very careful to provide services at each site that are accessible and done exceptionally well. Next slide. This is anybody familiar with what this is? This is northeastern Massachusetts, just in case you couldn't tell that. Thank you very much. This would be Gloucester over here. This is where we are right there. I'm sorry, we're right there. As I came up today, I realized why this is such a special community. It's not just all about the mayor. It is. It's also this amazing vista. Just turn around and take a look at that. That is just spectacular. I'm sorry, the mayor's spectacular too. But anyways, this is a combination. This is Lahey Health System. And you can see we had a broad geography, but it's northeastern Massachusetts. It's this country. Next slide. This is what Beth Israel Lahey Health, again, March 1st, what we will look like as of then. The new system, we went through an extensive regulatory process. Two of the primary values, which is why we joined Beth Israel, is respect for independent physicians. A lot of our physicians on staff are not owned or employed by us. They're independent. We think that makes us better. That's what they want to do. We don't have a desire to change that. And they have support for community hospitals. The community hospitals south of Boston, which were part of the Beth Israel network, have done extraordinarily well under Beth Israel. The community hospitals affiliated with Lahey, ourselves and Addison Gilbert, have done extraordinarily well. We know that will continue in the future. There's a lot of planning that's gone in while we went through this extended courtship. Actually, it wasn't a courtship, it was a legal proceedings, but kind of like a courtship. Local impact is we're going to keep care within the system. That's important to you, important to us. Dr. Tabb, who's the new CEO designate of Beth Israel Lahey Health, did a town hall at Beverly on Monday. He's doing another one in Gloucester at Addison Gilbert. Is it the 23rd, Cindy? 25th. I'm sorry. And that's just to get to know him. He is a nice guy. He's very focused on healthcare, very focused on ensuring, like as I said earlier, that healthcare is a right, not a privilege. And we, as two hospitals, I'm the CEO, we will be on the same level as all the other hospitals in the system. That's also important to us. We have a seat at the table. Really important to us. Next slide. This is what Beth Israel Lahey Health will look like. There's Beth Israel. I won't go through all the numbers. There's Lahey Health. This is the New England Baptist, Mount Auburn, Anna Jakes, and Newburyport. And the combined system will be about $5.2 billion. Big number. But the largest provider in the state, the system Partners, is about $14 billion. And that was one of the reasons why we got together, is even at Beverly, or at Lahey at about $2 billion and Beth Israel at about $2 billion, we still did not have scale or economic clout, if you will, to be able to compete effectively with Partners. Unfortunately, and as I said in the beginning, you want us to operate as businesses, and business is about competition. So that's an important characteristic for us. We also thought we could do a lot better things together than we could individually, and I'm sure that we will see that in the future. This is what, I know you all know what this looks like. This is Eastern Massachusetts. This is a concentration of what Beth Israel Lahey Health will be as of March 1st. And the difference between this slide and the other slide is you can see the concentration south of Boston. The green dots are where our patients originate in the Lahey system. The bluish purple dots are where they originate in the Beth Israel Lahey Health system. And what this gives us is both geographic spread, certainly gives us scale, but most importantly, primary care physicians, we'll have a primary care physician within 5 miles of 75% of the citizens of Eastern Massachusetts. That's a big deal. So if you live in Gloucester or work in Boston, or live in Boston and work in Gloucester, you wanted to access, you can be part of our system and have that be convenient to you. We'll have a managed patient population of about $1.3 million, and 400,000 of those will be at risk, which is risk is, I won't go into this, but it's a different way to pay us. In the past, we've been paid on what we call fee for service. The more we did of something, the more we got paid. Now, the government payers and the commercial payers are saying you're at risk, which means we give you a set amount of money, you need to achieve this quality. If you do it at a lower cost, you get to keep the difference. And that is beneficial too. That's also helped bend that cost curve. Next slide. This is one of the reasons why we joined Beth Israel and Lahey Health. This is a relative how costly systems are versus other systems in Massachusetts. The most costly is the one I referred to earlier as Partners. Partners is not a bad system. I don't mean to say that. They just are the dominant and the most expensive system in Massachusetts. As you can see, this is Lahey, and this is Beth Israel. So the two together are in the very far end of the cost curve. That's also advantageous to you. We don't expect to raise prices. We expect to be able to lower costs. So the only other thing is that if we are successful in shifting patients from some of the high-cost providers to us, that's a savings for the Commonwealth. And the Commonwealth is very interested in that. They're not interested in shifting patients from one to another, but they are interested in reducing costs, as I talked about earlier. New services at Addison Gilbert. So new clinics. These are, so as I spoke about earlier, we may not do all the services at Addison Gilbert, but for a lot of the services that patients seek, you really need to see a provider pre and post test, pre and post procedure. For example, these are some of the new services that we have. Bariatric surgery. We don't do bariatric surgery at Beverly. We don't do it at Addison Gilbert. It's done at Lahey Clinic. But quite frankly, the surgical part is the shortest amount of the interface with healthcare. It's really the pre and post-op visits. And so we've had a bariatric surgeon who will come to Addison Gilbert, do pre-op workups there, understand all the factors that need to be understood, have the surgery done at Lahey Clinic, and then come back and have that post-op work at Addison Gilbert. Same thing with wound. We've got a Center for Healthy Aging, which again helps us from the perspective of taking care of patients as they age, but keeping them healthy. Who was I talking to? Lisa Bonneville, I think, about that's your same focus also. And then, of course, the urgent care centers. This was a big leap for us, but through the from a generous benefactor, we were able to do a study that said that the city of Gloucester could only support one urgent care. And we wanted to be the first. Also, the mayor asked me to open one too. Just a minor other consideration. She said, what we really need is an urgent care. And quite frankly, it's been wildly successful. How many patients do we see a year?
A little over 12,000.
A little over 12,000, just in 1 year. It has had an impact on our emergency department. We've seen a decline in some volume, not significantly, about 10%, which is what we predicted. But those aren't patients that should have gone to the emergency department in the first place. They're patients that are better served in an urgent care center. Less costly, quicker, better service, more appropriate for that care. And from a business perspective, less costly for you, right? I see a lot of heads nodding from the bankers over on the left here. And from all of ours perspective. Overuse of the emergency departments in Massachusetts, and certainly nationally, is one of the biggest challenges we have. Now, we did this to cannibalize some of our business, but we knew it was the right strategic decision to make. We don't have one in Beverly. We've got one in Gloucester, and we've got one in Danvers. Again, consistent with that, we're not going to try to be all things to all people in all places. Try to do them well. Next slide. Planned construction, we're reinvesting in Addison and Gilbert. We've got a new expansion of specialty clinic space happening next month. New pharmacy, that's about a $2.5 million investment. We need to meet the current regulations. We've also got a physical therapy, occupational therapy, relocation and expansion. Senior adult unit, which is the unit, so this is a unit that specializes in taking care of the elderly who may have diseases of the brain. And when I say diseases of the brain, that means Alzheimer's, dementia, or it might even be medication-related dementia. It does an excellent job of managing those patients, understanding what their baseline can be, getting them to that baseline, and then discharging them as appropriate to home, to wherever is the next appropriate location. Oftentimes, the number one thing that they do is reduce the amount of medications that patients get. Part of our society is we don't coordinate care. We give patients too many medications. That results in confusion. Not all patients, but some patients. And please, take your medication as your physician prescribes. Don't let an administrator tell you not to take your medication, okay? And then future refurbishment of Steel 1, which is our medical surgical unit, and expansion of our cardiology suite. So those are some of the investments that we're going to be doing in the next year. I won't spend a lot of time on this, but we also are expanding the outreach of Addison Gilbert to the communities. Cindy heads up what we call a high-risk intervention team, which is seeing those patients who show up in an emergency department 12 or 14 times a year for conditions that, if we got to the base reason why that patient showed up in the emergency department, we would avoid those emergency department, in some cases an inpatient admission. I think it was one patient who kept coming to the emergency department because he kept falling at home. And everybody was trying to focus on mobility. Is it a mobility issue? Is there some physiological issue? The patient was a quiet alcoholic. Nobody knew that. The primary care didn't know that. The patient didn't even admit to that. Able to address that addiction, patient hasn't shown up in the emergency department for a year. That's success. Better quality for that patient, better outcome for us as healthcare providers. Most importantly, much better life for that patient. We also have a neonatal abstinence syndrome. Unfortunately, because of the opioid addiction, epidemic rather, we have about 50 babies a year that are born at Beverly Hospital to mothers who are addicted. You imagine the baby starts off, so the baby is therefore addicted. First thing that has to happen is that baby has to be weaned from that addiction. Because we had such a strong program, the state gave us a grant, again, Cindy's in charge of that, to extend that. One of the things we've been able to successfully do is we used to have these babies and they went into special care nursery, and although we put them on medication regimes and other things like that, what we recognized is what they needed more than anything else is just to be held. So we had a volunteer cuddler program. Any volunteers? That was successful. Now we've understood that those babies don't have to be in the special care nursery. They can room in with their mother in our pediatric unit, and that's a less cost for the system, better for the baby. We also have the ability to influence that mother's behavior, or not behavior, excuse me, but address that addiction, and that's important for us too. These are what we call social determinants of health. Next slide. So what next? I'm not going to reveal everything about the new system, but one of the things that Ken asked me to do was, what can you do as businesses? And to help, this isn't to higher the cost, this is to reduce the high cost of healthcare and improve quality. I'm sorry, those are, but as consumers or businesses, social determinants, help us focus on housing, employment, those other things. Where's Scott? Scott Scott Trenti. Scott, is that some of the things that you see from your perspective too?
Absolutely.
Yeah. Housing, employment, addiction, so more focus on those types of things, which become, unfortunately, the root cause of a lot of the reasons why we treat patients in hospitals and in healthcare. Wellness and prevention, smoking, weight control as an employer. If you don't have programs to help patients do that, I think we're missing an opportunity. Management and treatment of chronic conditions. We have an extensive array of services at Addison Gilbert to be able to do that. Use low cost, high quality. I apologize. Let me fix this slide before you distribute it. That's us. Now, I'm the CEO, I'm going to say that, but I think you saw some of the data that proves that. If there's an illness, ailment, concern about treatment, primary care first, always primary care. Urgent care if the primary care directs you. We don't want to take business away from primary care. We want to supplement the primary care. And third is emergency department, which we have. What can BILH do? So some of the things that we're going to do as our new system as of March 1st. And focus on wellness and prevention. We talked about that. We have a long history of doing that within Beverly and Addison Gilbert Hospital, but that is going to be the focus, to keep patients out of the hospitals, keep them out of healthcare. We're not in business to perpetuate our businesses. We're in business to take care of patients. Primary care coordination with behavioral health. We have some pilots about this. Oftentimes, behavioral health or mental health conditions or addiction go untreated, unrecognized in a primary care office. If we have a social worker or other licensed mental health professional embedded or in that primary care practice, it helps us easily identify that, takes away some of the stigma of a patient admitting that, gives them the opportunity to get that help, and therefore helps us bend that cost curve and improve quality and life. Support and strengthen community hospitals, we talked about that. We will be working on that over the next years or two to see what does that mean in practical terms for Beverly and Addison Gilbert. Coordinate care with our academic and teaching hospitals. Leahy has an extensive array of services. Beth Israel has an extensive array of services. In some cases, they have services that the other doesn't. We'll be able to refer within our network and coordinate that care. Most importantly, what's next? We're going to make a difference in the lives of the patients that we serve. This is a direct quote from Dr. Kevin Tabb, our CEO, so please don't give me credit and don't say Phil said this. This was actually him. But I think that's a profound statement. It's not about growth. It's about making a difference in patients that we serve. Next slide. So I won't go into this right now. I'll kind of stop there, but I just wanted to say that I did reference the Patriots earlier, and one of the comments one of the refrains from the Patriots this year were, everybody thought they were down and out, they weren't going to make it, and their comment is, we're still here. I'm here to tell you that we're still here, and in about 70 years, when Addison Gilbert approaches its 200th anniversary, there'll be a CEO here who will be able to say, we're still here. It won't be me, by the way. I just want to make sure you understand that. But we are still here. Thank you very much.
We do have some time for some questions if you'd like. Over to you, Phil.
I'm sorry. Please, in the back.
Yes, good morning. Thank you for coming. First thing I want to say is I've got first-class healthcare at Leahy, and don't have any detail about.
Well, thank you, but one of our new partners is in Boston, so you may want to.
Don't mention that. But almost all of my providers complain about what appears to be an oppressive amount of paperwork that they have to do in the course of their day, that they have to do at night and on weekends. Is there any, and I think I saw this on 60 Minutes also about the amount of paperwork that the doctors have to do. Is there any efforts to manage that a little bit better?
Sure. So actually, that's a great comment. Thank you for making that. There was Dr. Alan Chowie, who's actually president of the Mass Medical Society and also on staff at Beverly and Addison Gilbert Hospitals, just published a recent white paper about physician burnout. And one of the prime reasons for physician burnout was the administrative and bureaucratic burden associated with the paperwork, the insurance coverage, and also the electronic health record. Because although the electronic health record gives us a lot of capabilities and provides coordinated care, it is a incremental burden on that physician in the practice. Is that what you're talking about, part of that you're talking about. So from our perspective, we're going to do a couple of things. One, we're going to look at that and understand exactly how can we streamline that process to be able to make it more friendly to the provider. I'm talking about the electronic health record. The second component of that is that we've got an initiative, and I know some of our physician practices where this is most common, to be able to lift the skill sets of each of the individuals in that practice, whether it's a medical associate, whether it's a nurse, whether it's a nurse practitioner, to the highest ability or highest capability of their license, to be able to lessen the burden on that provider. That's shown quite a great amount of success, because unfortunately the health record was designed so that the physician had to do everything. That's not the way it should be, and not the way it can be in the future. So those two components will help address the electronic health record. The other component of that, which you talked about, is administrative burden. I happen to serve on a special committee on finance of Mass Hospital Association, and I'm also on the board of Mass Hospital Association. And one of the things that they're looking to do is try to get administrative simplification, because quite frankly, the different health plans have different requirements, different paperwork. You got to do this, dot this T, cross this I. Believe it or not, that's actually what we think they want us to do, is cross an I. Yeah, it doesn't make any sense. Sorry. No, anybody from the health insurance companies in the room? No. So those types of things, that administrative simplification, and you must see that as business people. Do you see the paperwork associated, right? So you understand that. That is a big burden. So we won't be able to address it right away, but we're acutely aware of it and focused on what we call provider burnout or physician burnout. Other questions?
No, but I have a statement. So everyone can understand too. I worked at Embassy Hill Hospital for 20 years. I still volunteer on Fridays for them. Let me tell you what else that we're doing. That you're looking at numbers and you're looking at projections and things that are happening. Let me tell you what our local hospital's been doing. Now, when we had an opiate crisis, we needed the ANGEL program. Not only to have an ANGEL program, our police officer and our social workers. Not only did they supply social workers and work closely together and got grants, and he wasn't joking when I forced him to do the urgent care, and he was putting
Force is a strong word, but
But the fact is, as soon as I became intern, I said what we need in this community, and we all work together. But I also need to let you know that we also work together. If it wasn't for all of you giving the support, we would not be merging. We would not be working together, and we do need it. We do need to cross that bridge. As far as being a healthcare expert, half of you know that the networks, the tiering, it's costing us in deductibles. Our employees don't want this insurance because they have to pay a higher deductible. All of a sudden you notice that your tier went up because you're going to a local hospital here and your tier went up to a specialist. Dr. Zanger went to $20 to $60 when it's the same doctor. It's because, no offense, but between partners and hospitals merging and fighting and everything else, who pays for it is the consumer. So I went with them, and Dr. Tab, he's been in Gloucester, he loves it, so he's going to be a frequent flyer of Gloucester, so you don't have to worry about that. We went to the Attorney General. Half of you in this room, with your support and your letters, made it happen. Let me tell you what else is happening in Gloucester. Now, we did the opiate, we did the beds and everything else. What have we all been hearing in our school system? What's happening? How do we protect our children? There's no juvenile beds. Mental health for juveniles is so bad, and they have to wait hours and days. We had it going one person 3 days in our ER, not because we have lack of doctors or anything else, beds. Because some of you don't know, Anna Jakes is one of our little hospitals that we are together with, have beds, and they can expand, and we're looking at that. I just got a text from the governor saying that, you know what, that's one of his main goals is education, but also mental health. We're going to set up already, Cindy and myself, and with Senator Tarr, a meeting in my office with the superintendent and both principals of Amelie and high school to get together to see what we can do for Gloucester. And then we're going to go beyond that. So with your help and support, Gloucester is the beginning. Addison Gilbert is here to stay. Everyone says it's changing. I want it to change. I want it to go better. I asked for those beds because how many premature seniors, because the medication's off, are going into nursing homes. And because we don't know it was just a medication of Alzheimer's. Thank you, Scott. Dementia community. We're ahead of everything. So I want to thank you, Phil, because I know sometimes I can be a pain, but thank you for always running to my office. And so Cindy, thank you, because together we are making it better for everyone. Thank you.
Well, I will say that,
Check in the mail.
thank you. The word sometimes, I would say the answer is never. Thank you. You're an advocate for the community, you're an advocate for healthcare, and that's what I am also, and I think that that's important from all of us. I did focus a lot on the numbers. This is an economic outlook. I focused a little bit about the new system and what it means, but happy to answer other questions or comments. Yes, sir.
Yeah, similar to what the mayor had said, I'm finding from talking to people, there's a major crisis, I think, going on when it comes to mental health services, therapy services for juveniles. They have to travel long distance. As soon as a therapist no longer has to take a charge, they don't. So, you know, if you want the best therapist, a lot of times it's private pay. So if you just comment on that.
Yeah, that is unfortunate. I don't have an answer, but I do have some concepts that I think are in the works. One is, you're absolutely right. There is a shortage of psychiatrists in total across the United States. There's also a shortage of, there's an even more acute shortage of psychiatrists who take care of juveniles or children. Absolutely correct. And unfortunately, the way that Mass Health pays for that, or some of the other, it's not advantageous for those providers to take those patients who have Mass Health. I talked about earlier, 1 in 4 of the citizens of Commonwealth are in Mass Health, so you can imagine what happens when it's not beneficial financially. I don't mean that they're gouging, it's just not beneficial financially for them to take those patients. So there's a lot of initiatives to try to increase the amount that Mass Health pays those providers to make it economically viable for them to continue to provide that service. And we as a system also, I'm talking about Beth Israel Lahey Health, are also going to be focused, even before the mayor asked us to an hour and a half ago, going to focus on behavioral health for kids and access to that. We don't have a lot of answers at this point in time, but we do understand the need. We had a child who stayed in our emergency department for 3 days because there were no beds. 3 days. That child did not get any treatment, some treatment, but not the treatment that child needed. And if you can obviously understand that if you have a behavioral health distress point and you spend that time in an emergency department, that's just not a great setting for that. I did tell the mayor that Anna Jakes does. We have 92 behavioral health beds at Beverly and Addison Gilbert in combination. 92 out of 365, which is about 1/4 of our beds are psych. That is a very high percentage for community hospitals. We don't have child psychiatry or adolescent psychiatry, but Anna Jakes does. And we expect to be able to leverage that in the future. Not sure where, but expect to be able to leverage that. I met with the CEO of Anna Jakes just earlier this week, and we talked about a lot of things that we could potentially do jointly.
Thank you.
Thank you. Other comments, questions? Yes?
Could you address the system's relationship with community health centers?
Sure. I'll address it from a micro level, and then I'll address it from a macro level. The micro level is from the Gloucester Community Health Center, which is located next door to Addison Gilbert Hospital. The building, I believe, was donated by Addison Gilbert Hospital. I'm sorry, 3/4 of the building. I don't know how you donate 3/4 of a building, but anyways, we managed to do that. Was that all we owned at the time? Yes. Okay, so we donated all that we owned. It's condos. I guess we didn't own the roof or something. I'm not sure what. But we did donate that building because we understood that they needed a place, and we wanted that place to be close in proximity to the hospital. We have a close working relationship with them. They send our patients. They send us patients. We send patients to them as appropriate. So that's one thing. We also had a capital infusion of them in the initial stages to be able to weather some of the financial storms that they had. That's the micro level. We also, at Beverly, we have an obstetrician in close proximity to Lynn Community Health in Lynn, and we do various things with them, which I won't go into now, but also support them. From the Attorney General's perspective, also, Beth Israel as a healthcare, the previous system, had relationships with, I think it's 3 or 5 community health centers, I can't remember which, but did a lot of financial support, did a lot of clinical integration, a lot of clinical coordination, and they've done that for years, and because it served the patient population that they both shared. The Attorney General wants and had a condition of allowing the merger to take place, that those support for community health centers would not diminish and would in fact improve. So from the from the micro perspective, we've always supported local community health. From the macro perspective, from the new system, there is there was always a mission to do that. Now it's an Attorney General requirement. We didn't have any desire to back out of that, but the Attorney General thought that was good to work into that agreement. So I hope that answers your question. Other questions, comments? Yes, sir.
I'm Red Hand, and I just moved to Cape Ann 8 years ago.
So, a newcomer.
Newcomer, right, well, Lloyd. I've had a number of opportunities, I don't call it opportunities, I shouldn't say, to use your facilities. Been in the emergency room a number of times, was forwarded to Lee with septic pneumonia, which I survived. I still keep my primary care physician back in the western suburb of Boston, which I've been with him for about 30 years. But the other day he said, hey, look, don't come in here to see me about this. Go see urgent care. I was very impressed with that facility.
Excellent.
So I've had a chance to be forwarded also another time to the Beverly Hospital. And every time I've gotten excellent care, and congratulations.
I just want to clarify, he is not one of the plants I talked about earlier. He just met me. I did want to just go, Cindy, can you forward a couple of slides? I just did want to, if we just want to have 1 minute, I just did want to recognize, I started the talk by saying that we are a 501c3 not-for-profit organization. And so although we are financially successful, we produce about a 1% margin, but if you understand what we've got to reinvest to the facility and technology and everything, it's not that much. So we require philanthropy. So we have, next slide. So we've been very, very, very grateful to our benefactors in the larger Cape Ann community who have supported Addison Gilbert and supported Beverly Hospital. This is a listing of some of them. I won't read them all, but this is a listing of that, and that allows us to be as good as we are today and will allow us to be better in the future. This is a terrific opportunity for you all to get involved in philanthropy too, but no, it's a terrific opportunity for us to publicly thank those donors. And the urgent care was as a result of a donor. Next slide. The J.M. Barker Foundation, who helped us fund first the analysis of urgent care, understand the impact upon our emergency room, and then helped us fund the construction of that. And because that was so successful there, the system, Leahy Health System, has subsequently opened up 2 other urgent cares, one in Danvers and one in Linfield. So that actually, the very generous donation of a benefactor set not just local, but regional strategy. And that's an important consideration. You can make a difference. Thank you.
Thank you, Phil. That was great. Thank you. Thank you, Phil. That was really terrific. And thank you again for all of you for coming out. Just very quickly, we're 5 weeks into 2019, and we have already had a big, big year. We have a number of events coming up, and you're going to see all of this through our Chamber communications. But please join us next Wednesday. We'll be at Ryan and Wood for our business after-hours networking event. Come sample Bob's latest brew there and enjoy being with us and that incredible business. We have a multi-chamber collaborative event. So more and more we're collaborating with chambers around the North Shore. We're going to be at the Beauport Hotel, and there'll be 4 chambers involved with that, including the North Shore Chamber, Beverly, and Salem. That's going to be capped at about 50 people. So come in and sign up for that with us early. And then our big first raffle of the year is our Irish Sweepstakes. There are a number of people here in this room that have tickets. They are the best odds in town. We are going to give away $20,000 on March 13th. March 13th, and top prize is $10,000. A number of things right after that, the Career and College Fair. This is our 5th year that we're doing a Career and College Fair here on Cape Ann. We used to bus our kids into Boston. Now we go to Gloucester High School. We'll have 75 colleges there. We'll have over 50 business people there talking about career paths. It's a wonderful opportunity for our youth to come and learn about what are the options for continuing education and for job opportunities here on Cape Ann, including the trades will be well represented. So a number of things going on over the next few weeks and into March. Please stay tuned for that, and have a great day and great weekend. Thanks again for coming.